that we arranged. As you might have been aware, this week or this month is the Breast Cancer Awareness Month, and thank you also for wearing pink today. And we have invited Dr. Thampy from the NMC Hospital in Abu Dhabi to walk us through the breast cancer illness overall, and also to answer in between, we would say, right, some questions that you might have, or some concerns, or whatever comes into your mind. Please feel free and ask these questions. And not only the ladies in this room, also gentlemen. So feel free. Thank you.
Thank you. Thank you for this introduction. And last time I think we discussed about some myths and facts regarding cancer. The same problem there.
Yes, yes.
Yeah, okay. So this time, especially we come here because of this month. October is the Breast Cancer Awareness Month, or we call it as a Pink Month. And usually we are also very busy like giving this awareness, especially this month. Okay, so I prepared some slides, but I'm not going through the old slides. Maybe it can be just an interactive session. You can just ask any questions or your doubts. And this is not only for ladies also. Even the guys, they are not. They can come because they can use it for their friends, their families, and it's not like a. Because why I selected, because breast cancer is one of the most common cancer all over the world, worldwide, breast cancer. So I have some data from India. From the data from India, what they tell, every 3 seconds, one lady is diagnosed with breast cancer in India. Okay, it's much more higher in the Western world. It's much more higher in the Western world than India. So it's very common, very common. So and in our OP practice also, if we say 80% of our cases are breast cancer. So it's not to scare anyone. It's not to scare you, but we know when we have the knowledge about this, we can actually somehow to try to prevent it. So it's only our why these awareness campaigns are done, because everyone should be aware. And I want to break some myths also. So one of the myths that even gents won't get breast cancer. No, it's a myth. In gents also there is breast cancer, but not as common as ladies. Okay? We have maybe it is maybe 10% compared to the breast cancer in ladies. 10% males also get breast cancer. Okay, but the other thing, the same treatment, everything is same. So that I think I will come through. So I just start on the slides, but like you can ask any questions, or can be just interactive. You can ask your doubts. So whatever will make it useful. So first of all, I will just tell you what is cancer. So cancer is like, we all know that we have normal cells in our body. Okay? All our entire organs are made up of cells. So usually what happens, so you can, the first picture is what it is showing is a normal cell division. So this cell division is happening in our body. What happens, some cells will grow, and after some time these cells will die and new cells will come. This is happening like every organ, this is happening. So what happens, what is cancer means, what happens, some cells are formed, but these cells are not getting killed, or these cells are not getting damaged, new cells are not coming. So that what happens, the same cells start again and again growing. So this is some uncontrollable growth of these cells, and this is actually known as cancer. So it can happen anywhere, any part of your body this can happen, because our entire body is made up of cells, different type of cells. There are different type of cells. Any cell and any organ, any body, this can happen. What is the reason for this uncontrolled growth of some cells? We are not clear. We are clear about few causes, but the entire thing, around the 40% of the reasons we know why this happens. But the remaining 60% still, we are unclear why these cells are proliferating like this. So, coming to common cancers in women worldwide, breast cancer is the most common, followed by cervical cancer, lung cancer, and colorectal cancer. Since I am from India, there is more data from India. That's why I put some slides of India also. So India also, at present now, the most common cancer is breast cancer. Previously it was cervical cancer. As our sanitation, the hygiene, everything improved, actually the cervical cancer has come down and breast cancer has increased in number. So the one thing is, like, we usually will think that it won't never happen to us, it will never come. Usually we have such kind of thoughts. But what my advice is, like, everyone, we should be all aware what are the symptoms or how it happens. We all should be well aware, so that we immediately we can know when some of the small symptoms comes, we can immediately go to a doctor, because it's very important. The most important message I have to convey is regarding the early detection. So if we can early detect a breast cancer and it is completely curable, so if we detect it in the first stage, this breast cancer is completely curable. That's one thing. The second thing is, you don't have to undergo a lot of treatments, like all this chemotherapy, radiation, all this treatment also. If it is detected very early, we can treat it also very easily, even without this chemotherapy and other things. Okay, so if I take a female breast, actually it's composed of few things. So it's composed of mainly, this is a little bit maybe science, I don't know how much it will be into it. So there will be something known as some terminology. You can just be aware of some terminology. So there will be something known as lobules, lobes, ducts, and collecting duct. So two things: there is a duct and there is a lobes. So the cancer can affect both the duct and the lobes. So it is known as intraductal carcinomas and intralobular carcinoma. Lobules are there. Lobules form this duct, and duct forms the collecting duct, and that's the way how the milk actually. As we know, the primary it's for the milk production. So it's all the anatomy is based on how the milk production. So it's basically the anatomy is the physiology is mainly for the milk production. Yeah. So before starting, first I will go through. I'm not showing you some of the slides. I think it can be very interactive session. So first I will discuss some of the risk factors for the breast cancer. So coming to the risk factors, mainly it is divided into modifiable and non-modifiable. Few risk factors, it's because we can modify and it's in our hands. But few risk factors, it's non-modifiable. So first we will discuss what are the non-modifiable risk factors. So obviously the first one is the sex, the female sex. That is one of the non-modifiable. Females are more prone for breast cancer than men. So it is one of the non-modifiable risk factors. The other one is the age. So as the age increases, age advances, the risk of breast cancer also increases. Okay, but now we are not seeing such a scenario. Yesterday I had a patient, she was only 30 years and she was diagnosed as a very advanced breast cancer. I have patients with 25 years, 20 years, all this. So more we are seeing as the age advances. Now in young women also, actually the breast cancer is becoming common. Maybe there is some bias also because we are in Abu Dhabi and here the working population is young and maybe we are seeing more of young patients. That will be the reason. But otherwise, as age increases, the risk of breast cancer also increases. The third one, and mainly it's maybe not modifiable, is regarding our fertility and hormonal changes. So coming to the hormonal changes and the fertility. So few things. What I'm going to tell here is only some risk factors. Okay, it's not like mandatory, or it's not like when I tell something you feel that okay, also I am like this. No, nothing like that. It's only some risk factors which I am telling. So one thing is the number of kids, or when you have no kids. See, all this what I am going to tell is connecting with your menstrual cycles. So as you know, breast cancer is one hormone-driven cancer. So it has many. It is dependent with your menstrual cycles also. So how is dependent? You know when a lady when menstruating, the estrogen and progesterone. These are the hormones, the female hormones, which are responsible, and it is secreted. So when you have your menstrual cycles, the number of the amount of your progesterone and estrogen is high, and these hormones can actually stimulate one of the reasons for breast cancer. So one thing is having more kids, or maybe 2 or 3 kids, is one of the things which reduce the risk factor. How come? You know, when you become pregnant and when you breastfeed a child, there is amenorrhea, or your periods are not there this time, and like that, when in your body, when these menstrual cycles are less, the risk of breast cancer is also coming down. Is it clear? Yeah. So one thing is when you're having more kids, yeah, the risk of breast cancer is coming down. That means those who are not having kids, actually the risk is high. This doesn't mean that those who are not having kids immediately are going to, nothing like that. Okay, don't worry. Because whatever the things I am telling is only relative risk factors only. Okay, some risk factors, some non-modifiable risk factors. The other thing is breastfeeding. So the mothers who breastfeeding at least more than 6 months, they have the risk of breast cancer is less in them. Okay, these are some of the reason is also clear. As to the time when you breastfeed, if you 1 year you feeding the baby the breast milk, you know your periods are not there at least for that 1 year. So that is again reducing your estrogen and progesterone stimulation to your breast tissues, and that is why they are telling there is a reduced risk when you are breastfeeding your baby at least more than 6 months. Okay, and the other non-modifiable things are early menarche and late menopause. So you know what is early menarche? Early menarche, usually the menstruation starts at 12 years or 13 years. But nowadays, seeing the kids, the menstrual cycles are starting at 9 years and even at 8 years. Okay? These are one of the risk factors. As the menstrual cycles are more in your body, these estrogen actions are more and you are under risk factors. So why this nowadays we are seeing this early menarche, or why kids are getting menstrual cycles very early? The reason are unclear, but it is also related to our lifestyle or our life activity, like especially the food, the diet, the junk foods, all these things now more than less like our kids are into, like this may be some of the reason why this early menarche is happening. Okay. In the same way, late menopause. So this also we know usually the menses stops at 48, 49, 15 that years, but if your menses last more than 55 years, again you are in risk, your risk for getting breast cancer is slightly higher. So this is all related to the amount of estrogen and progesterone, and the you understood, I think, the basics what I am trying to do. Yeah. So early menarche, late menopause, nulliparous, breastfeeding. These are some of the hormone-related risk factors, and also hormone replacement therapy. So you know what is hormone replacement therapy? Usually after menopause, you'll be taking some of the to avoid the menopausal symptoms. You'll be taking some hormone replacement therapy, and these are also actually there is a risk for developing breast cancer. And also oral contraceptive pills. So oral contraceptive pills nowadays it's not much dangerous, because previously we had a lot of estrogen in the oral contraceptive pills. Now what happens, the newer oral contraceptive pills are more of progesterone, which is comparatively less risk than estrogen. So previously the oral contraceptive pills was one of the risk factors when we talk about breast cancer. That is also one risk factor, because all this contains estrogen. Now coming to the modifiable risk factors. Which are the risk factors which we can modify? So obviously the first one is our lifestyle. The lifestyle, the first one comes with the obesity. So overweight or obesity, one of the scientifically proven risk factor for developing breast cancer. How obesity leads to cancer, or overweight leads to cancer? So when you know there's adipose tissue, with obesity there will be fat tissues will be more, and this adipose tissue, other than your ovaries, adipose tissue also will generate estrogen and progesterone. So when you became overweight or more obese, what happens? The more fat tissue, and these tissues also can produce more of estrogen and progesterone, and that is one of the reason for risk for developing breast cancer. So obesity and lack of exercise is one of the important reasons which is scientifically proven for breast cancer in ladies. In gents, especially the intestinal cancer, colon cancer, these are also directly related to obesity. The other one is smoking. Smoking is one of the risk factors for developing breast cancer. It is also, without doubt, it has proven smoking is one of the risk factors for developing breast cancer. Third one is alcohol. Not like smoking, but even then there is a risk factor with alcohol also for developing breast cancer. So coming to the main modifiable risk factors: obesity, lack of exercise, smoking and alcohol. These are some of the modifiable risk factors which we can do something and we can modify. So these are some of the risk factors which are associated with breast cancer. Now I'll come to the symptoms. So how you can detect this, how you can detect it early. 90% of the time, first of all I have to tell, if you find any lumps in the breast or any swelling in the breast, don't think it is going to be always cancer. 80% of the time it's not cancer. Okay? If you find a breast lump, the chance of it becoming cancer is 20%. 80% of the time it is something benign. It can be a cyst, it can be fibroid edema. There are a lot of benign reasons for a breast lump. So all breast lumps are not cancer. So, but 90% of the time, how they present is usually with a breast lump. Most of the time, it will be a painless breast lump. Usually, there won't be any pain. It can be any part. It can be usually the breast is divided into 4 quadrants. If you to one vertical and one horizontal line, it is divided into 4 quadrants actually. So we usually call it as upper outer. It's not required for you. So anywhere in the breast, if you find a lump, usually 90% of the time you present with a lump, painless lump. So any lump you are finding in the breast, please come to a doctor and just get it examined and do the necessary things. But don't get panicked. As I told, 80% of the time it's not cancer. The second thing is any discharge from the nipples. So especially bloody discharge, any blood discharge from the nipple. So this is another common symptom of breast cancer. And any color change, especially around the nipple and the areola, if there is any color change you are seeing, that it's not like cancer, you have to take some medical attention. Okay? And there is any size difference or there is an asymmetry when you examine yourself, you find there is any difference in the shape or size between the two breasts, and that also you have to be a little careful and just take a medical attention. So usually these are the symptoms how a patient comes with. Only thing, usually it is not associated with pain. Okay, so a painless lump, you should be more careful than when there is a pain. When there is a pain, most of the time it will be some infection, some mastitis, some inflammation, all these things. But usually breast cancer is not associated with a pain. So a painless lump always you should have to be. But all other benign things also, which I told, like a cyst, a fibroadenoma, all these are also associated without pain. Okay, so painless lump you have to be careful. So these are some of the symptoms how we usually present. And one more important thing, not only in the breast, usually whenever there is something in the breast with the adjacent lymph nodes, there is something known as lymph nodes. So lymph nodes, we all have lymph nodes, our entire body have lymph node, and we have lymph nodes in our axilla or our armpits. So whenever if the right side breast is involved, there is a chance that the right side axillary or in the armpit lymph nodes also involved. Sometimes what happens, there won't be anything in the breast. Sometimes you will feel only some heaviness or some lumpy feeling in the axilla, in the armpits. That also you have to be careful. If you find anything unusual in your armpits also, sometimes what happens, sometimes the breast lesion will be very, very small. You won't be able to find it out, or it won't be even palpable. But sometimes what happens, they will present with these armpit swellings. So the armpit swellings also you have to be careful. And also the shoulder pain. Sometimes the presentation, this axillary lymph node, they present with this right or left side pain of the shoulder. So anything like if you find some unusual pain in the shoulder region, which is lasting for a long time, like more than 1 month without any other reason, better to get there. These are not very common symptoms, but what we are seeing is usually our mothers or sisters or friends, like they'll have some pain, they'll just ignore it, and as ladies, like you're more concerned with the family and other things, you always try to push all these things and keep it relaxed. So any unusual pain in the shoulder region, any swelling in the armpits, any unusual lump or color change, nipple discharge, change in the size or the change in the symmetry, anything like that, you have to be just careful and just take a medical attention. Again, I have to just tell that only there is a chance becoming cancer is 20%. So don't get panic, don't get unnecessary anxiety. Because I'm coming to one more risk factor is anxiety and stress factor. I think this I have discussed last time also. So this I have also now proven that our stress and our anxiety, this is going to reduce our immunity, and this immunity reduction is not only cancer, we are prone for many diseases. So don't get unnecessary stress or anxiety, because that is also one of the risk factors for the breast cancer. So we discussed the risk factors, we discussed about the symptoms. So how, the important topic when we are coming to how we can detect it early. So I think this maybe the media is much projecting this, and you all will be aware of these things. So the first thing which I have to tell is a self breast examination. So we all know about selfie. So this is self B. Okay, it is more important than taking a selfie is self B, and that is self breast examination. And this should be done monthly, at least once. Once in a month, you have to do self breast examination. Okay, when you are taking a bath or whenever you have free time, take at least 15 to 20 minutes. it's better to stand in front of a mirror and just examine your own breast. That is known as self-P. See for the things which I told, any change in size, color, any discharge, any lumps, all these things. And also you yourself have to use the hand and palpate both the breast and see, and also your armpits. So this is self-breast examination, and this should be done at least once a month. So I have some pictures usually how to, you can go to the net and you can find exactly, they will tell you how to do a self-breast examination. I not put the videos, but
we actually shared your brochure. We've given all the ladies the brochure before, and inside there it shows you how to do this.
Yeah. So first one is a self-breast examination. The second one is a mammogram. Okay, so mammogram is just like an X-ray. You don't have to worry about mammogram. It's not harmful. Okay, it's not harmful. Only thing, usually it's like X-ray. The breast will be compressed in between one film-like thing. It's not painful. Many think that it's very painful procedure. No, not at all. The neuro mammograms are not at all painful. So when you have to do a mammogram, either above 40 years or 50 years. So at least when you are above 40 years, at least twice in a 2 times, like means once in 2 years. Okay, you are above 50 years, at least once in a year. You have to get a mammogram. This is really very, very important, and this is one thing which you can detect the breast cancer very, very early. Don't hesitate to do these mammograms. And one I think even most of the hospitals are offering free mammograms just to bring that awareness. Okay, even NMC is having a free mammogram till this month. So don't hesitate. Get a mammogram done if you are above 40 years. Okay, and if you are less than 40 years, and if you have a strong family history, or in your family you have history of breast cancer, mammogram won't be much useful because the breast will be very dense less than 40 years. So that what happens, even though we do a mammogram, we won't be able to identify because it will be full of glands and cells. So in such a case, we advise either an MRI of the breast or an ultrasound of the breast, not the mammogram. So before that, I will tell you about one more risk factor regarding, most of you will have a doubt regarding whether it is hereditary, whether it runs in family, all these things. So only 5%, only less than 5% of breast cancers are actually happens in the family or it runs in the family. That means 95% of the breast cancer is not a familial or a hereditary disease. So you don't have to worry. Who are highly prone, like in your family, how we know that in your family whether it's running? So one thing is, in your family, at least if anyone is having a breast cancer or ovarian cancer, okay, and that especially in your first degree relatives. So first degree relatives means your father, your mother, your siblings, or your brothers, your sisters, all this. So any of your first degree relatives is having a 1 or 2 are having a breast cancer, that is a risk factor. Maybe in your family there will be a gene that you have to find out. Any males in your family, any male breast cancer in your family, okay, that will be also a risk factor. If anyone in your family who is having breast cancer in both their breast, bilateral breast cancer, any of your first degree relatives in your family. Okay, and also in your, not even your first degree, your second degree relatives also, if there are 2 or more than 2 people with breast cancer or ovarian cancer also, there is a risk that maybe this runs in your family. So these are some of the things which you have to look whether breast cancer or ovarian cancer runs in your family. So before going to the screening thing, I just finished one more thing. So you must have heard there is a test called BRCA. So it is known as BRCA testing. BRCA. BRCA. There is a 2 genes, BRCA1 and BRCA2. So this is a simple blood test, and this will tell whether this gene is positive. And if this gene is positive, that means this breast cancer runs in your family. And if this gene is positive, there is around 70 to 80% risk you will be developing a breast cancer by the age of 60 years. Okay, so this gene is known as BRCA1 and BRCA2. So this is, we won't do this test for everyone. This test will be done only those who have a strong family history. The strong family history, the features I just told you. Only if you have these things in your family, only then it's indicated to do, not for everyone. So you will be knowing about the Hollywood actress Angelina. So you know what she has done. So yeah. So she has also done this BRCA testing, and it was positive for her. She had a strong family history, and to reduce the risk factor, she has done a bilateral mastectomy. She removed both of her breasts. Okay, so this is BRCA testing, and this is not done for everyone. Don't just go to a hospital and tell you have to do this genetic testing. No, it is. I know it is like a highly panic situation. So don't just do that. It is only for those who have very high risk factor in their family. At least 2 or more in your first degree relatives, or 3 or more in your second degree relatives. If anyone in your family who is having bilateral, both the breast cancer, if anyone of like males in your family having breast cancers, so these are some of the risk factors. It is only done for those people who have these features. Okay, and that test is known as BRCA test, and it's very useful for detecting it early, and you can do some prophylactic surgeries to avoid it. Okay, so I was in the screening. So mammogram, I was talking about more than 50 years and more than 40 years. At least once in 2 years, you have to get your mammogram done. And why one is early detection, and other thing initially which I told, if you are detecting in the mammogram a very small lesion, sometimes a small surgery, and you don't have to remove your breast completely also, sometimes only that lump you have to remove, and you don't have to undergo any further treatment. So that's the important one, another important point of detecting these things early. Otherwise, you might have to go to chemotherapy, radiation, and all these things. So that's the importance of early detection. So I told you about self-breast examination and a mammogram, and if possible, at least examination by one medical person at least once in 6 months. So these are the 3 things which are related as like how we can screen and how we can early detect breast cancer. So now coming to the another important aspect, the treatment of breast cancer. It's not maybe some of your friends or relatives are undergoing the treatment. For them, I'm just telling you. So treatment mainly is divided into 3. So surgery, there is chemotherapy, there is radiation, and there is hormonal therapy. So coming to surgery, so first of all, you'll be scared about the surgery. So now it's not like even if you are diagnosed with breast cancer, we are going to remove your entire breast. No. So if there are some indication, if the size is large, and there are few indications, sometimes we have to remove the entire breast. But now most commonly what we are doing is a breast conservation surgeries. That means we will be removing only the lump, only the swelling, and also we will be removing, as I told, there will be some lymph nodes in your armpits, so that lymph nodes also will be removing. So that is known as breast conservation surgeries. So don't think or don't many a time especially when young, we are diagnosed, we are worried about the breast removal and other things. So don't get worried. It's not a complete breast removal. It is, even though you are diagnosed with just a lumpectomy, so you will be conserving your breast. So other thing, after the surgery, then there will be some treatment called chemotherapy and radiation. Many of you will be scared of hearing the word chemotherapy. Chemotherapy are just medicines which are given to treat breast cancer, and everyone not requires this chemotherapy or radiation. It all depends upon in which stage you are diagnosed, and there are some biological types which a doctor will be saying. Only for few people all these things are required. For some, all these 3 are also required. Okay. For some, all the surgery, chemo, radiation, everything is required. For few people, only surgery will be required. For few people, only chemo will be required. So it depends upon the individuals, about the stage and other things. So one thing I have to tell you is, don't get like whatever the media is telling, like don't get scared about all these things. So these are not the breast, as I told, we can conserve your breast, and also regarding the chemotherapy also, there are many new medicines without the least side effects. Now previously, before 2009, everyone was so scared of these medicines because there are a lot of vomiting, hair loss, all these things. So now we have even good medicines which will completely, we can prevent the vomiting. There are no vomiting nowadays, and even for the hair fall, we have few things. We have something called a cool cap. When you're taking chemotherapy, we'll be applying a cap, and we can even prevent your hair loss. Okay, so all these things, there are a lot of advancement. So don't get just scared when you hear about the breast cancer. It is like now it's highly curable now, and it is like anything like any other disease. Okay, it's any other disease. You have to just come, detect it early, start your treatment, you'll be fine. Okay, many of my patients, they are coming, they are taking the treatment, they are going for their work, they all are fine. Even there are patients more than 5 years, 10 years without any problem. Okay, so now coming to some of the, but I will just conclude before that. I will. So these all things I have already told you, so I am not showing you again. So this is how a mammogram looks. Okay, this is how a mammogram looks once it's taken. And what she's doing there is an ultrasound. There is an ultrasound, And these are how the mammogram pictures. So in the mammogram, you can very easily, you can see some hyperdensity here, right? So you can see it will be difficult, but you can identify very early the mammogram pictures. This is all I just discussed with you. Yes, prevention maybe I will just again highlight on this diet. So diet which is rich in fruits and vegetables. Any diet which I am telling now, right, it's all like obesity is the main thing or overweight is the main thing. So whatever you are eating, just be limited, and maybe the main thing is do regular exercise, and you should not go into an overweight. That's the main thing than any particular food. Exercise and being active, and regarding the hormone replacement and contraceptives and so on, you want to do. So we discussed this. I already told you, men don't get breast cancer. No, men also get breast cancer. Okay, it will be less. It will be around 10% compared to the females. Men also get breast cancer. But the treatment and other things, what I told is everything same. But usually there is no mammogram, since there is no breast tissue as such. Mammogram is not there for gents. Usually it is an ultrasound what we do for guys. So finding a lump means you have breast cancer. This also I told you. It's only 20% chance a lump can become cancer in the breast. 80% of the time it's a benign. Mammograms are harmful? No, mammograms are not at all harmful. The radiation which is coming to the mammogram is very, very less, and compared to when if you can early detect, the benefit is much higher. And it is with some mild pain, it's not otherwise a painful procedure. Breast cancer is contagious? No, breast cancer is not at all contagious. Usually my patients will come and ask whether I have kids with me, whether I can sleep with them, whether I can eat. It's not at all contagious. Cancer, as such, not only breast cancer, none of the cancers are contagious. Antiperspirants, deodorants cause breast cancer. This last time also I discussed. There's a lot of things when you use these deodorants in the armpit. There are many concerns. There are some studies came like that, but it's proven it's not like that. The deodorants are not causing cancers. Size matters in breast cancer. So this is especially the breast size thing. The size is there some other controversies like that. The size increases the breast cancer is nothing like that. It's not related to the size of the breast. Positive gene test makes sure the person will get cancer. This is the test which I told you about, the BRCA testing. That means even though if the test is positive, the chance of getting, like in the family, is only 25%. But if you test positive, your lifetime risk is around 70 to 80%. But I am again telling you, this is not for normal people. It's only for those who have a very strong family history in their family. It's only for them.